the plans that are going to be imposed upon individuals and employers most certainly will have an impact. While there no doubt be chiropractic coverage, the concern is that the cost of these premiums is going to go up, and especially for employers, they're going to be faced with the choice of paying substantially higher premiums in order to preserve lower deductibles, or keeping their premium costs relatively level and accepting and imposing on their employees much higher deductible insurance plans. Now, the impact of that is going to be dependent on whether some employers are going to be willing to create HSAs and fund those HSAs on behalf of their employees so that they don't feel the deductible pinch. Some employers aren't, and I think it's going to be a function of the size of the employer, the amount of resources. But I have to reasonably anticipate some impact where you're going to have patients coming in with enormous deductibles that you can never get past, in which case, yes, they will have an insurance card and they will have coverage, but it'll be coverage that doesn't ever result in any insurance payments to the chiropractor because it could never do enough covered services, medically necessary services, to ever get past a several $1,000s deductible. So I think because of that, providers are going to have to look at coverage, determine whether there is any potential to provide covered services, even assuming the patient needs them, is willing to present for them, and then present options as to which way the patient wants to go. Do they want to pay out of pocket and have those services apply to their deductible and follow all the coverage rules, or are they just there for palliative relief, couple visits, and you drive that as non-covered care through the S code and counter-based coding, which isn't covered, and they don't even bill. So those are, at a minimum, I think those options, and they have to be, realistically, they have to be presented now, because even with a lower deductible doesn't mean that everybody has coverage, because unfortunately many patients don't want or aren't looking for that course of care. They don't have the time for it, and they don't have the and there are out-of-pocket expenses associated with that as well. So, I mean, that's a choice that I think needs to be presented to patients now. I think the need to present that choice is going to become more apparent once the employer mandate kicks in and we see how the coverage shakes out.